My name is Patty and I'm a student nurse practitioner. Today I'm going to do your abdominal assessment and assess your peripheral vessels. Is that okay?
Yeah.
It'll take about 10 minutes or so. Can you tell me your name and your date of birth?
Kathleen Taylor, 8/22/77.
Good. And is it warm enough in here for you?
Perfect.
I'm going to be doing some touching, so I'm going to try to warm up my hands and my stethoscope. The first thing I'm going to do is lay you back and just start taking a look at your legs and feet.
Okay.
And head back. And yeah, there we go. And get warm there. All right, so on external exam, Kathleen's skin is pink and normal texture, nothing shiny, not dry, and she does have hair present, meaning that she has some good blood flow. Next thing I'm going to do, Kathleen, is touch your feet just for warmth, okay?
Mm-hmm.
And her feet are equally warm. Good. No edema. You can go ahead and relax your feet. And the dorsalis pulse is a 2, equal, bilateral. Veins are not collapsed. Next I'm going to go into posterior tibial. Present, bilaterally equal at a +2. Good, and no edema. Next I'm going to move up to the popliteal pulse. And I'll do one at a time here, keeping my fingers and hands warm. And popliteal pulse is present at +2 on the right. Just a little bit here. Go ahead and bend a little bit. Good. Good, and present at a +2. Go ahead and put that down there. It'll keep you warm. Next, Kathleen, I'm going to feel the femoral pulses. So I'm going to pull this down just a little bit. And up. And, I'm sorry, I'm going to go maybe right. Good pulse and I'm sorry, is that tickly?
A little.
Good, and she's bilateral, a +2. May I see your hands? And so Kathleen's hands are pink and warm. Capillary refill is brisk, less than 3 seconds on the right. Bilateral warm on the left, and brisk at less than 3 seconds there. I'm going to feel some pulses here as well. Radial pulses are +2, equal, bilaterally. Good. Next I'm going to move to the brachial pulse. Good, that is +2. Good, +2. I'm gonna feel the aorta. Good, palpable, normal, +2. Next thing we're gonna do, I'm gonna raise you up a little bit. And I'm gonna have you turn your head to the left, maybe a little bit more. Actually, that is really good. And so I really don't need the light to see it, but she has good, and it's not pulsing, so it's the vein. So I'm gonna check for venous pulsation pressure. Might lift the head of your bed up just a touch. Sorry, that's close. Good, perfect. And have you turn your head to the left for me. Good. And the highest maximal point of venous pulsation is here. Let's see here. Let's do it. And so that would be 1.75 centimeters. All right. Good. I'm gonna feel the carotids as well, just a little bit, lower than the jawline. Good. +2. And good, +2. So next I'm just going to listen everywhere for any murmurs, any bruits. All right, and the carotid first. None heard. None heard. And lift your shirt up a bit. Over the aorta. And none heard, epigastric. Renal. Iliac. Good, none heard. For the next one, I'm going to listen to femoral, but I'm going to need to do it on skin. So I'm going to pull that little area down. Is that okay?
Mm-hmm.
Okay. None heard. Same thing on this side. And no bruits heard. just gonna look first. A little bit more. There we go. And down this like a little bit. All right, on external exam, Kathleen, her abdomen is bilaterally equal. No obvious masses or hernias. There are no venous patterns noted. So, okay. Good. The next thing that I'll have you do is just lift your head up a little bit so I can see the muscles. And with her head up, that does not bring up any masses or nodules or anything that sticks out. And go ahead and relax. Next thing that I'm going to do is listen, starting with the right lower quadrant in the diaphragm. And vowel sounds are heard in all four quadrants. Good, all four quadrants. Right on those. Okay. So next I'm going to do some percussing around the belly. It'll feel like kind of knocking or tapping, okay? If there's anywhere that's tender, you'll let me know. We did do the artery. We listened to the arteries during the peripheral assessment. So, all right. So next I'm going to find the borders of your liver. This is the first area that does not sound tympanic to me. I'm just going to move down this time. I hope that's okay. I'm sorry. And from the lung, I should be here dull and then down. I'm sorry, it's on my finger. That's it right there. And that would be 3 centimeters. And then I'm gonna do the same thing for the spleen here. And the spleen is right here. You can tell how it gets a little dull. Next, I'm going to move down to the gastric bubble, just below the rib cage here. and it's right there. Okay. Let me wipe this off of you here, and then we'll start with some light palpation. If anything is tender, you'll let me know. Is anything tender before we begin?
No.
Okay. Good. Good. No obvious masses or nodules on light palpation. Next, I'm going to move to deep palpation. And again, if this is a lot, let me know. Good. Okay.
Mm-hmm.
Good. So again, on deep palpation, nothing, no masses, no nodules. Next, I'm going to try to feel the borders of your liver. So what I might do is stick my hand underneath here to kind of pop it out a little bit and see if I can feel that. No obvious liver here. So liver is non-tender and of normal size. Next thing I'm going to do is also the same thing to feel the spleen, okay?
Mm-hmm.
Kind of right where I percuss, where we know it is. And the spleen is not tender, normal size. Next thing I'm going to do is try to feel the kidneys. So you're going to feel my hand slide underneath and press deeply on each side, okay?
Mm-hmm.
Okay, and again, you'll let me know if that's right about the area of the 10th rib. And I do not feel a kidney on the right side. And then come around to the left. Tender? No, and kidneys not noted, normal size, non-tender.
Get warm.
Okay, almost done here. Last bit, I'm just going to palpate right around the belly button and see if I can find the gallbladder as well. Looking for any umbilical hernias here. And no hernias, no masses, no nodules here. And in the area of the gallbladder, any tenderness here, non-tender, gallbladder not obvious, no masses noted here. The last thing that I'll have you do is sit up, and I'll help you here. And I'm just going to feel the back to see if your kidneys are tender. Good, and what I might have you do is swing your knees over to the side here. Good, and I'm going to lift up just a little bit. And at the actually I can do this with this down. Tender?
No.
Tender?
No.
Tender?
No.
Okay. You can go ahead and sit back. And Kathleen, that is the the completion of our exam today. Do you have any questions?
No.
Okay, thank you very much for your time. Let me put your seat down. Thank you.